would like to touch a very dear issue to us, that is the employment of our personnel in the country. Basically, this is going to be clearance to recruit by ministries, departments, agencies, and local governments for the financial year 2025-2026. At the beginning of this financial year, if you recall, the Ministry of Public Service issued a press statement on the state of the human resource management in the public service of Uganda and guided with key strategic frameworks required for effective utilization of the human resources to implement government programs in the financial year 2025-2026. And among the issues guided on was recruitment in the public service. Section 7 of the Act, the Public Service Act 2008, empowers the Ministry of Public Service for the overall management and administration of the public service, including the formulation of and review of policies relating to structures, management systems, and the terms and conditions of service. It also receives and considers on behalf of government proposals for remuneration remuneration and benefits of persons whose emoluments are payable directly from the consolidated fund or out of money provided by Parliament. Similarly, sections A14 of the Uganda Public Service Standing Orders 2021 vests the responsibility for ensuring proper implementation of human resource management procedures, policies, practices, structures, systems and terms and conditions of service for the public service in the responsible permanent secretary, who is the permanent secretary of the Ministry of Public Service. In accordance with the above provisions, the Ministry of Public Service granted clearance to recruit for a number of ministries, departments, agencies, and local governments in financial year 2025-2026 as follows. Now, these are the vacancies cleared for recruitment in the public service. Ministries, departments, agencies, and local governments cleared to recruit. At the beginning of this financial year, on the 16th of July 2025, clearance worth 5.48 billion shillings was granted for newly upgraded Health Center 2s to Health Center 3s, with funding support from Gov'T. And those entities that were cleared to recruit included Arocha Health Center 3 in Apache, Municipal Council. The status was new and the funding source was Gov'T, and the additional wage that was required was 360 million. Nsao Health Center 3 in Kira municipality, it's a new health center funded by Gov'T. The amount of money was 360 million. Kibiri Health Center 3 in Makindi, Sabagabo, it is new and funded by Gov'T. The wage requirement was 360 million. Nyangiria Health Center 3 in Koboko Municipal Council was new, funded by Gov'T. Again, the wage requirement was 360 million. In addition, 130 ministries, departments and agencies and local governments were issued clearance to recruit a total of 6,853 employees worth 324 billion 874 million 302 165,000 in this financial year 2025-2026, and the list of those institutions that were cleared is of course attached to be able to see it. Priority for recruitment was given for heads of department, especially in local governments. This is in order to strengthen the development and implementation of government policies and effectively supervise and monitor government programs. Other recruitment priorities were given to strengthening staffing levels in primary schools, primary health care, agriculture extension and parish chiefs, staff, stroke town agents, and the clearance by payroll category is as follows. For central government institutions, there were 966 people, amounting to 30 billion 409 667 and 672 million. Local government and conditional grant 1,316, amounting to 22 billion 51 016,996 million. Primary health care, again a conditional grant, amounting to 1,477, and the amount of wage requirement is 36 billion 652 504 183 million. Primary education conditional grant, we recruited 2,316 people, costing 16 billion 697 million 498 464. Urban and conditional grant, 448 personnel were recruited, requiring a wage bill of 7 billion 52 million 465 698. Then the agriculture extension staff, this was a conditional grant. 212 personnel were recruited, amounting to 9 billion 307 million 336 752,000. Secondary education, 14 personnel were recruited, amounting or costing 210 million 576,000. And of course, the other level, decentralized tertiary, was not recruited. So that gives us a total of 6,749 personnel requiring a wage totaling to 122 billion 380 990 501. Despite this, there are some entities that have not submitted priority areas for clearance, in spite of them having a wage. Now, there are 29 folks that have wage for recruitment but have not submitted critical vacant positions for filling as earlier guided. These votes are reminded of the deadline for seeking clearance to recruit by the 30th of December 2025, as communicated under established notice number 2 of 2025. So we would like those votes really to move very fast and seek clearance for the rules of public service and recruit. There are many Ugandans who want to serve. Let them be given the chance, since the door has been opened by government. Cities that have not yet sought clearance include the following: Mulago National Referral Hospital. The total wage available for recruitment is 294 million 738 541,000. Arua Regional Referral Hospital, the wage required and available is 1 billion 547 416 976 million. Oima Regional Referral Hospital, the wage available is 401,338,138,10,000. Kabale Regional Referral Hospital, the wage requirement available is 110,155,088. Masaka Regional Referral Hospital, the wage available is 811,695,792. Mbarara Regional Referral Hospital, the wage available is 522,373,012. Moroto Regional Referral Hospital, the wage available is 188,561,493. Mitiana Municipal Council, the wage requirement is available is 254,561,493. Sorry, 254, 137, 200 and 527,000. Nansana Municipal Council, the wage available is 456,22,706,000. Bugiri District, the wage available is 335,105,661,000. Bugweri District, the wage available is 633,355,400,000. Bukedea District, 259,550,209,000. Buyende District, wage available is 192,609,343,000. Dokolo District, the wage available is 283,447,615,000. Karenga District, the wage available is 277,840,221,000. Kasese District, wage available.
Abakozi abagenda okukola mu bitongole ebya Ministry of Health, Ministry y'obulamu, nga bino ebitongole ebya wansi ebayita Health Center 2 ebitandikibwako Health Center 2 ne Health Center 3, nga tusinzira ku buyambi bwe twafuna mu World Bank, banka ey'ensi yonna, ne program gye bayita Gov'T. Wano byengenda okwogerako byebigenda okufuna ku nsimbi zino eziwandisa abakozi. Abantu baffe basobole okufuna obujjanjabi okuviira ddala mu ebyo ebitongole ebya wansi. Arocha Health Center 3 nga kisangibwamu Apach Municipal Council. Nsawo Health Center 3 nga kisangibwamu Kira Municipal Council. Kibiri Health Center 3 nga kisangibwamu Makindye Ssaabagabo Municipal Council. Nyagilia Health Center 3 nga kisangibwamu Koboko Municipal Council. Monjera Health Center 3 nga kisangibwamu Rubirizi District. Era nga kipya, ebyo byonna by'enjogedde nga bitongole bipya ebya Health Center 3. Ne tudda ku ebyo ebitongole ebikuzibwa nga bizze ku ddaala erya wagguluko kulwa engeri abantu gye bweyongeddemu obungi. Kyondo Health Center 2 kisangibwa mu Bundibujjo District. Kabingo Health Center 2 nga kisangibwa mu Kasese District. Butungama Health Center 3 nga kisangibwa mu Ntoroko District. Hatongo Health Center 4 nga kisangibwa mu Agago District. Kira Health Center 4 nga kisangibwa mu Kira Municipality mu Wakiso District. Nyabirongo Health Center 3 nga kisangibwa mu Kasese District. Ne Wera Health Center 3 nga kisangibwa mu Amuria District. byonna biwanikibwa bizze ku ddaala eddala. Ekyo kitegeeza nti services oba obujjanjabi ne bye basobola okukola byeyongedde. Ekiddako ebitongole 13 nga mulimu ministry ezawakati, mulimu districts ne agencies endala. Twagisiza ne tubakkiriza okuwandiisa abakozi 6,853 nga bagenda kutwala obuwumbi obusukka mu 124 era lisiti enkalakalira y'ebyo eri mu kiwandiiko kino. Mu kino tutadde essira okuwandiisa abakulira zi department mu local governments nga twagala okunyweza engeri gye basupervisingamu n'okulaba program eza gavumenti nga ba DHO, district health officer, district engineer, district education officer, okutwaliza awamu. Ekirala kye tukoze nti essira eddala tulitadde okwongeza ku bakozi abakola mu primary schools, amasomero agasookebwako, ne primary health care nga bwenjogedde, ne ba agricultural extension workers, abo abawa amagezi abalimi mu ngeri ki gye basobola okukola emirimu gyabwe egy'okulima n'okulunda. Ne tugattako ne ba parish chiefs stroke town agents. Nga bwe mukimanyi gavumenti yaddeetadde nnyo essira era ekuliriza parish development model. Kati bano ba parish chiefs stroke town agents be basookebwako wansi mu local governments n'awalala okutereeza ebiwandiiko n'okumanaginga sente za parish development model. Mulimu ebitongole ebimu ebitanaba kutuwa bye twabasaba mu kwetegeka okuwandiisa abakozi. Bino biri 29 era tubiwandiise muno, mulimu district n'amalwaliro agamu tujja bibakwasa. Tugenze okwetegereza nti ebitongole ebimu neba nga tubawadde olukusa okutandika okuwandiisa abakozi bagenda mpola nnyo okukikola kuba kwebyo ebingi ennyo ebiwera 130 abamu ne kakati tebanaba kuyisa biwandiiko mu mawulire ne ku mikutu emirala egyogera ku bakozi be beetaaga. Era wano tubakubiriza bakitandikeko mangu. Ne twogera ne ku ekyokulwisa oba okwogeza abasaba emirimu. Ng'olumu ekigendererwa kusaba nguzi oba kubalemesa paka we batuuka ku point ey'okubuuza ki ekirala kye basobola okukola. So wano tukubiriza abantu baffe abasaba emirimu nti okukola mu gavumenti oba okusaba omulimu kya bwereere, tekuliko nsimbi zonna ezikwatibwa ezeetaagizibwa okusasula basobole okuwandiisa oba okuyingira mu bya interview. byeyongera okujjukiza ebitongole byaffe, ebitongole bya gavumenti, nti awali okuzzaawo omuntu omulala awummudde oba agenza wala tekyetaagisa kusaba lukusa. Ebitongole byetaaga ne bizzaawo oyo omuntu ng'oli abuuza myezi 6 nga tanawa kufuluma ekitongole. Tuziize okuzza essente ez'emisaala kugizza mu treasury. Ekisembayo twogedde ku okutendeka abo abafunye emirimu betuwandisiza abapya kasita baba nga bafunye gino emirimu nga tebanaba kuweebwa we bagenda okukolera. Tusabye ba accounting officers bonna ababantu ba officer abapya tusooke tubatendeke mu ngeri ki gavumenti gyekolamu n'okubamanyisa amateeka agagenda okubatwala n'ebirala ebiringa ebyo.
This thing happens, of course, they raise the issue immediately to the chairperson of the Recruiting Commission and of course the Ministry of Public Service, and oftentimes the excise, if there is ample evidence that recruitment has not followed the right procedure, the recruitment exercise is repeated. So all we need is for people to be bold enough and come up and say, look, we went for the interviews, we did, but they were a mere formality. Somebody had already been recruited. Most likely that person didn't appear before the interviewing panel, and the exercise, therefore, the interview is nullified and it's done again. But the competent people, the most relevant people are recruited. I think the question of providing contracts to retiring public servants has progressively reduced. The incidence has reduced. Once you clock 60 years, it's mandatory. You must go. And all systems, by the way, have been put in place to ensure that you go. One is that you not access any payroll as soon as you have hit 60. And then what you want to get from government is now the pension requirement, so maybe you go to the pension side and get what you want. However, there are exceptional circumstances where contracts are awarded. One, when that job requires certain special skills which are required but are not yet available in the body of civil servants that are made, then a contract is awarded to that person so that the 2 or 3 years that that person is still there are used by that person to induct and mentor the people who are going to come after. But such circumstances, fortunately now, are very rare, in that Uganda has advanced very far in terms of preparing the manpower that is required and providing the various skills which we want in the job market. So such instances are reducing day by day.